In this video, I'll be going over the pros and cons of using the Bausch & Lomb enVista toric for suture fixation. Now, the unique thing about this lens is that it does provide astigmatism correction and can be suture fixated because of its eyelets. No other lens like the Zeiss CT Lucia, the Bausch & Lomb Acryos, or the Alcon CZ70BD, those lenses cannot provide astigmatism correction. And so if you have a patient who is left aphakic, for example, because of a compromised capsule, who has a high amount of astigmatism, you can consider using this lens and then suture fixating it. Now, in terms of the cons, this lens provides 2-point fixation. Obviously, the higher the point fixation, the more stable the lens is, the less likely there's tilt. Now, the 2-point fixation is also true to the Imani technique, but if you compare it to something like the Acryos lens, which has 4-point fixation, that is theoretically better. Now, the one thing I do want to highlight with these lenses is that although they do provide astigmatism correction, the eyelets, which you can see here, have been shown to fracture with time, and that's because of the constant tension of the suture on the eyelet. And so what some studies have shown is that the suture will actually continue to pull, and this actual eyelet will fracture either here or will completely fracture at the haptic optic junction. And of course, once the eyelet fractures, the lens will completely dislocate again. And there are reports of a patient who's aphakic, had this lens, had it suture fixated, and then a year or two later comes back with eyelet fractures. So, like I said, there are pros and cons with every single lens. But in this specific case, we've got the unique aspect of astigmatism correction, and the downside is 2-point fixation and the possible concern of eyelet fracture. Hope you found this video to be useful, and thanks for watching.